Dear listeners, welcome to Healing Mindset, where medicine meets mindfulness. I'm your host, Archita Garg, and today we are joined by Dr. Julius Torelli, a visionary cardiologist who has spent over 4 decades reimagining health beyond prescription. Through his Gratefully Well method, he teaches that true wellness begins not in the body, but in the mind, with gratitude as the heartbeat of healing. Hi, Dr. Julius. It's a pleasure to have you on my show.
Thank you. I appreciate the invitation. I'm honored to be here.
Great. So, Dr. Julius, after 40 years in cardiology, what made you shift from the traditional medicine to mindset-centered healing?
It was sort of a slow evolution, really. But I had the awareness the last week of medical school. I was doing a family practice rotation, and a patient came in, and she was very sick. She had nausea, vomiting, dry heaves for about 3 days. She couldn't keep anything down. She was very dehydrated and such, belly pain. Excuse me. And we didn't know what was going on. So we put her in the hospital. We gave her some IV fluids and we ran some tests. So we did multiple tests over about 3 days, and the tests all came back normal. And she was feeling, a bit better after 3 days. And so I went to discharge her, and I was writing her discharge instructions and sitting down and making some small talk with her in the room. And I said something like, well, we're going to get you home and where you can get some real rest, because you can't rest in the hospital. People are always bothering you. And she said, oh, I wish. I said, you wish? What do you mean you wish? She said, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down. And in that instant, this was now about a day or 2 days maybe before I was going to graduate medical school. So I was finishing my at least formal education before I was going into my training. And I had this sudden sort of awareness that it was intuitively obvious to me that why she was sick. This was sort of, I don't know how well you would call it, but it was sort of emotional overwhelm is how I like to think of it. We would say just, psychometrists say it's very stressful, whatever they would say, but I'd like to just think of it as emotional overwhelm. Each one of those three things is a big deal. And to have three of those in a short period of time could very well, is very much overwhelming. So it was obvious to me what was going on. But then on the other hand, I had another thought. I was like, wait a minute, I'm finishing my education here, and I have never heard of this. We didn't have any lectures on this. I wasn't taught about this. I said, well, maybe I can go to the library and read about it. But I was like, where do I start? Where do I look? I didn't even know where to look. My next thought was, well, maybe, is this even really a thing? Because I didn't learn it. And so it seemed obvious, but then I said, well, if it is a thing, then I didn't learn about it, then how do I treat it? So all those questions that ran through my head, but it was a very busy time for me. I was having to move. I was in Tampa. I had to move up to Cleveland. I was, so a lot going on, but that patient stayed with me. And then over the next 3 decades or more, I saw this repeatedly, right? This issue where we would find what I today are referred to as medically unexplained symptoms, right? So people come in with all sorts of symptoms: headaches, neck ache, chest pain, palpitations, belly pain, muscle aches, back aches, fatigue, all of these symptoms. And when we run all of our tests, we don't find anything. And then we give these some kind of, fancy term like migraine headache, or irritable bowel syndrome, or chronic fatigue, or fibromyalgia, or non-cardiac chest pain. And we give these fancy terms, which for me basically means you're sick, you don't feel well, and we're not smart enough to figure out what's going on. So these are called medically unexplained symptoms or persistent chronic symptoms. And then we just treat these with medications, because we don't, in Western medicine, our toolbox to fix things, people go to the doctor that you want him to figure out what's going on. You want him to fix it, right? The toolbox has, you open it up. The first layer is procedures, right? surgeries like that. If you have headaches and a brain tumor, you need surgery, right? And you're going to do something like that, or maybe radiation therapy or what have you. And then, but if you don't find anything, you have belly pain, but you don't have appendicitis, you don't have a bad gallbladder, you don't have, Crohn's disease or something like that, then we just put you on medicine. We take out that tray in the toolbox. The only thing left in the toolbox is pharmaceuticals. There's nothing, we don't have anything else. And doctors want to help. Doctors are, well-meaning, and they want to help. And they start with, prescriptions with medications. And that's not to say the medications may not help. Like, if we use migraine headaches as an example, we've got pretty good medicines today that prevent migraines. We've got medicines that treat migraines. And, so I'm not against the medicine, but we also understand and know or realize that there's an emotional component to all of these, and we don't address that. So the medicine is fine, the treatment is fine, but we don't address that emotional component. So what my practice evolved, a long-winded answer to your question here, what my practice evolved into was adding what I like to think of as the non-physical dimensions of health into the evaluation and treatment of the patient. So when we look at a patient with headaches or belly pain, we look at the physical sort of manifestation, right? That's the headache or the belly pain that, sort of says. But we don't find anything, but we don't look at the mental health aspect, the emotional aspect, the behavioral aspect, the social aspect, the cultural aspect, the spiritual aspect of a human being, right? Those are all part of who we are. And so really that Gratefully Well method is really not replacing anything that's done in Western medicine. It doesn't say, we don't say, you have cancer, don't take that chemotherapy, or you have, the appendicitis, don't have surgery. You can do all of these things, right? You can take the treatment, chemotherapy, or, whatever it is. But then in addition, let's address these non-physical dimensions of health. And so it's additive. It's not really reducing anything. So I think of it as kind of, I don't want to call it a missing link, but a missing piece in the typical Western approach to the evaluation management of a patient.
Wow, that is so interesting. I mean, what you said, it actually reminded me of the placebo effect. When people think that, taking a certain medicine would help them with a certain disease, but in reality, it's just the mind doing its work. So
that's
yes,
the placebo effect is the perfect example, because in Western medicine, we acknowledge that the placebo effect exists. That's first. The second thing is we have a basic understanding of the placebo effect. We understand that it's all about mindset. We don't know exactly the psychophysiology that's going on necessarily, but we know that there is a mindset effect, but it's real. The pharmaceutical companies know it, and they hate it because they have to do placebo-controlled trials to show that their billion-dollar drug works better than a sugar pill, right? Which means a sugar pill works. So the placebo effect is exactly one great example of how powerful the mind is, how powerful thoughts are, how powerful beliefs are in changing physiology, which is not something that we talk about. So we talk about mindset, in peak performance. We talk about it in executives. We talk about it in the military. We talk about it in athletes. We talk about it in executives. We talk about it in all these different areas, but we very infrequently talk about it as it relates to health. And so that's part of what we try to do at the Gratefully Well, is emphasize how important these beliefs and thoughts and mindset are.
great. It's remarkable. It shows how healing isn't just clinical, it's deeply human and profoundly conscious. On that note, the Gratefully Well platform revolves around gratitude. So, why do you believe gratitude is such a transformative force for both the heart and the mind?
So the gratitude we use as a tool. So I think the foundation of Gratefully Well, as we just talked about, is really about mindset, right? So that's sort of where it starts. But once you acknowledge that mindset exists, then there are many tools you can use to change that mindset and to alter that perception besides things like, meditation and stuff. Gratitude is really a reframing, a thought reframing, because part of this is just thought. And so you can reframe that thought, and gratitude does it like instantly. It does it like, and you can do it on the fly. So we have many gratitude techniques, right? Gratitude, gratitude journals are very popular today, right? Everyone talks about write down 3 or 5 things. And there's evidence that shows how powerful gratitude is in the both affecting the benefits in both physical and mental health benefits. Okay. So we have a ton of evidence that shows this. And so, but some of the techniques of gratitude may not be all that effective. In other words, the quality of the gratitude is as important as the quantity, and maybe more so. So in other words, if you sit down to do your gratitude journal, you just write down 3 or 5 things kind of rotely, you're not into it, you're not paying much attention, and you just write, I'm, grateful for my house, and I'm grateful I have a job, I'm grateful for my wife, whatever. There may be an effect there. I'm not saying there's not, but one of the techniques we use, I call it the traceback method. It's a method that you can do on the fly in the moment when you're having sort of this negative emotion, and you can switch that emotion, if you choose, sort of instantly by taking one thing you're grateful for, tracing that back and amplifying that gratitude and bringing out what I like to call making it an awe-inspiring gratitude. And I think that can be done easily. You don't have to sit down. You don't have to take the time to do it. You don't have to get a journal. It can be done, in the moment, as opposed to having to sit down. And gratitude journal is great. Like I said, I'm not knocking it, but you have to sit down. You have to take the time to do it and all like that.
Great. Thank you so much for sharing that with our listeners. But have you observed measurable changes in any of your patients who practice daily gratitude?
Incredible stories. I go on and on. Again, importantly, there is scientific evidence to show that gratitude does have physical and mental health benefits. And so I wrote a book that's available on Amazon called Holistic Health Pathways that specifically lists the evidence that exists for the physical and mental health benefits of gratitude. But we have, many stories. Probably the best story I have is a woman who was on a heart transplant list. She had severe heart failure. She had an ejection fraction of about 10%, which is really bad. Anything less than 20 or 30% is severely weakened. And she had been on the transplant list for about 3 years. They were having trouble finding her a match, a donor. And long story, but she ended up getting worse. She got this pacemaker put in, a special kind of pacemaker that they thought would help. She had refused the pacemaker for a long time, for a year. And then she got real sick, and she said in a moment of weakness, she agreed to the pacemaker. And ever since they put the pacemaker in, she was worse. She had gone to where she could only walk about 100 feet. She was in the hospital, readmitted every 2 weeks. But she was getting worse. And she called me, and she wanted the pacemaker out. And it became very clear to me that she had a lot of anger, a lot of resentment toward this pacemaker. She was upset with herself that she had it put in. She was a sort of naturalist. She didn't want anything artificial in her body and all this kind of stuff. And so, long story, but we taught her this gratitude technique. Nothing else changed. The medicine didn't change. The heart failure didn't change. But yet, she started very religiously doing a gratitude journal every day for about 30 minutes or more, and changed her perspective on the pacemaker. And I told her, she goes, how do I appreciate it? I don't like this pacemaker. I hate it. I want it out. And I said, I didn't say you had to like it. I said, you just have to find a way to appreciate it. She said, well, how do I do that? And so I showed her in the journal, she could say, one day I won't need this pacemaker and they can take it out. But for right now, I appreciate the pacemaker. I appreciate the company that makes the pacemaker. I appreciate that they make billions of dollars, that they can do the research to develop this pacemaker. I appreciate the engineers who thought of how to make this pacemaker. I appreciate the people who make the stainless steel to put into the pacemaker. I appreciate the people who make all the little parts, all the little transistors, all the little chips that go into the pacemaker. I appreciate the leads that the pacemaker has. I appreciate the people who drive the truck to deliver the stainless steel to the manufacturing factory, right? I appreciate the farmers who grew the food to feed the engineers who develop, and that's the traceback method. You trace that back, and that amplifies the physiology of the gratitude, the positive, aspects of the positive physiology of the gratitude. Anyway, she started doing that, and over a period of 3 months, she went from walking 100 or 200 feet to walking 2 miles a day. She never got readmitted to the hospital. Her heart failure, the ejection fraction went from about 10 or 15% to 30%, which is still not normal, but it was much better than 10 or 15. And then eventually she came off the transplant list. Now, in that woman, the truth is that pacemaker was the right thing to do. From a medical standpoint, she had something called a left bundle branch block. It was very wide, and it was absolutely the right thing to do. But she had so much resistance toward this pacemaker. She had so much anger toward it. She was fighting against it. And when you fight against it, right, then what happens? You have a negative physiology, right? Your blood pressure goes up. That's not good in heart failure. Your heart rate goes up. Those things aren't good. So by basically accepting that this pacemaker and finding a way to be grateful for it, that changed her physiology and allowed the way I see it, allowed the pacemaker to do the things it needed to do. And so ultimately she needed the pacemaker, but she was fighting, we basically helped her see to stop fighting against it, essentially.
Wow, that is such an inspiring story. And the traceback method that you mentioned, I think that it can be applied in any aspect of your life, even not medically. So that's amazing, actually. And
Any aspect. You at the grocery store, standing in line, waiting and you're angry because you're late, and you're always in the slowest line, and you can, if you choose, and this is the important thing, right? It's a choice. If you choose, you find yourself, the way you know that you're doing this is if you're having a negative emotion, right? So I always say you're taking the victim mindset when you're having a negative emotion. If you recognize you're having this negative emotion, then you can choose to change your mindset. And you do that with the gratitude. So you just find one thing to be grateful for, right? Like, oh, I'm grateful for that all of this food is available to me. I didn't have to go out and plant, the seeds for these tomatoes that I bought, and for, these blueberries or whatever, and or this bread, but I didn't have to, grow the wheat and harvest the wheat and turn the wheat, mill the wheat into flour, and make the dough and bake the, I could just go buy this bread. So you can do that, like you said, in that instant, right on the fly, as I call it, in the moment, and we'll turn around your psychology just like that.
definitely, it's fascinating how something as simple as thankfulness can become a prescription for vitality. So great. But Dr. Julius, you help patients move from being passive patients to active participants. So how can someone start reclaiming that agency in their own wellness?
That is key. So in this country, and I think it's spreading to other, our parts of the world as well, we have placed all of the responsibility for our health and health care on the provider, the physician, the nurse practitioner, whoever the healthcare provider is. That, I believe, is a problem. Like, physician certainly has to be involved with your healthcare, but you need to take some responsibility. And if you're not willing to do that, well, then you're at the mercy of the physician, right? So in other words, if you have, let's say, diabetes as an example, type 2 diabetes in this country is absolutely positively epidemic right now. It's like out of control. It's a lifestyle issue. Yes, you do have to have the genetic makeup probably to develop type 2 diabetes, but you can modify the expression of those genes based on your lifestyle. So if you're overweight and inactive and you eat all this terrible food, you're likely to develop diabetes. However, if you change that lifestyle and you change the way you eat and you change the food you eat and you increase your activity, you can improve the diabetes. Again, there's nothing wrong with taking the medicine. The medicines do help lower the blood sugar. The medicines today are doing the right thing in insulin resistance and type 2 diabetes, but you can improve that or lessen the need for the medicine. And we've seen people even reverse diabetes just simply by changing their lifestyle, by knowing what to eat, changing what they eat, losing weight, and increasing their activity. And they don't necessarily have to go out and start training to run marathons or triathlons to do this kind of stuff. They can make simple, changes. And so we talk about, rather than talk about exercise, we talk about increasing your activity. And rather than talking about diet, we talked about just your nutrition and knowing what you're eating and how you're eating. Those are very powerful. But if you don't take that responsibility, the physician can't do those things for you, right? Can't change your diet. He can't change your activity level. He can't walk for you, right? And so if you're unwilling to do that, well, then you're a slave to the pharmaceutical industry, because you're going to have to take these medicines. The medicines don't cure your diabetes. The medicines will never reverse the diabetes like your lifestyle changes can. But if that's what you want to do, then that's fine. Again, no judgment. I'm not saying it's right or wrong here. I'm just saying that you're going to end up being on medicines forever, and you will be on increasing dose of medicine as the diabetes gets harder and harder to control.
Definitely. I mean, medicines are definitely helpful, but they are not the only thing that can help us heal. There are other aspects involved in it too. So, absolutely. But Dr. Julius, do you think that modern healthcare underestimates the mind's role in healing?
Totally. Totally. So we understand the placebo effect as an example and the nocebo effect, but we pay very little credence to that. Again, I think migraine headaches and irritable bowel are probably the two poster childs for that, right? And what do we do with people coming in with migraine headaches? We give them, a medicine to prevent the migraine, a medicine to treat the migraine if they get one while they're on that medicine. They're probably somewhat depressed, so we put them maybe on an antidepressant. They're probably not sleeping well, so we give them something to help them sleep. Maybe they're anxious, and we give them something for their anxiety. So they might end up being on 3 or 4 or 5 medicines, none of which, again, nothing wrong with the medicines perhaps, but there's nothing is dealing with the emotional overlay, the emotional component, what is the root cause or the foundational issue causing their headaches. So I personally think of, migraine headaches as, being a mental health issue. Is it a mental health disease? No, the counselors and therapists would probably get after me if I said it was a mental health disease, but I think it's a mental health issue. And I think everyone with migraines, as an example, or irritable bowel should see a therapist. I'm not saying that the physician sort of has to do it, but they should see, a therapist and learn techniques to help them deal with the emotional issues that are causing the root cause of their issues. And so that's where we don't give that enough credence. But in addition, even like if in known disease, like in cancer, we know, for instance, in different types of cancers, there are studies that show that patients with different types of cancer, like breast cancer, who go to support groups do better, live longer than patients with cancer who don't go to support groups. This is while they're getting all their treatments, surgeries, chemotherapies, radiation therapy, whatever it is. If they go to support groups, they tend to do better, but the percentage of people who go to support groups is less than 15%. People who continue in the support groups is even lower than that, right? Migraine patients, I think like 3% of them go to a therapist.
Yeah, that resonates deeply. It's time we treat mindset as medicine, not only as a side note. So, Dr. Julius, for someone facing chronic illness or burnout, where should they begin to rebuild hope and balance, according to you?
So I think the first thing that they have to do is they have to, again, be willing to take some responsibility for their health and their health care. That's the number one best advice that I can give. Now, they may feel like they have to go outside the healthcare system for that. I think it should be within the healthcare system, but regardless, there are a lot of resources outside the healthcare system, and that can be helpful. But that's number one. And then after that, I think they have to start to look for these resources where, if it's not going to be with their physician, which is unlikely, there are physicians, don't get me wrong, there are physicians who are doing this, but not the great majority. But if they have to go outside, there's a lot of resources, even outside the mental health field, as well. And so things like doing, learning meditation, learning breathwork, breathwork, when I first learned breathwork, this was in the mid 90s, 95, 30 years ago, 30 years ago. And, I was like, well, breath work, like I know how to breathe. And while it's true, we all know how to breathe, right? We weren't taught, we just inherently knew how to breathe. However, most of us, the great majority of us, forget how to breathe as we get older. And as we get tense, we forget how to do diaphragmatic breathing. And so most of us do all chest breathing, and we don't do diaphragmatic breathing. And so we have to remember, we don't have to learn it. We have to remember, how to do those kind of things. But anyway, those resources out there. So I encourage people to go out, and look at that. And that's what Gratefully Well and the workshops are.
Amazing advice. Thank you so much for sharing that with our listeners. Lastly, if any of our listeners want to connect with you or learn more about the methods that you have mentioned today, so how can they do that? Could you share with our listeners?
Sure. So the probably the best and easiest thing is to subscribe to the Gratefully Well newsletter on Substack.com. You can search for my name or search for the newsletter Gratefully Well. The newsletter is free, and a lot of these topics are discussed in the newsletter. And so I encourage everyone, to do that. In addition, you can go to the gratefully.well.com website, which is gratefully.well.com, and take our 7-day gratitude challenge. So there's a free 7-day gratitude challenge that, can help as well. And I encourage people to do both of those. Sign up for the newsletter, subscribe, and then do the challenge. I've got a book on Amazon that I said is called Holistic Health Pathways. And in that book, again, that's really about the evidence that exists to the physical and mental health benefits of gratitude. I have another book that will be available probably next week on the website that is about the effect, how to do like the techniques of doing gratitude besides gratitude journaling. So like the trace back method and things like that, how to do it on the fly and such. So that will be also available. And then I will be doing free introductory workshops. These will be probably an hour and a half online, virtual, so you can attend from anywhere. And these sort of explain the Gratefully Well kind of concept and model, and then give you some tools also that you can use. And then ultimately we'll have some closed group, longer workshops, like 8-week workshops in a closed group to work through some of the stuff.
Amazing. So I'll have all the details on my show listing. And lastly, thank you so much, Dr. Torelli, for reminding us that wellness is an inner practice as much as an outer pursuit. To everyone listening, may you take a moment today to breathe, to notice, and to be gratefully well, because the mind that heals itself heals the body too.